Hi. So, for students of University Malaya, hope that you are enjoying your semester breaks. And here we have Prof. Victor, occupational and public health specialist. And this is Cairo, a second year medical student. And here we are, we will ask about what is coronavirus. So Cairo, let's ask some questions.
Alright, thank you. Okay, thank you very much.
So,
Good afternoon.
Good afternoon.
Right.
So, I'll begin with the most asked question.
Right.
Can I know what is coronavirus? I mean, like the 2019 n-cov or currently known as COVID-19.
Okay, so coronavirus is basically a group of virus, alright, that actually is spread in human and also in animals. Alright, so coronavirus now basically is just a group of virus that is with particular virus actually now has spread from human to human. And of course, we all know it started off in Wuhan. Basically, Wuhan is China. So now it has spread to many countries around the world, including to Malaysia.
So can I know, because we know the name previously as Wuhan coronavirus lah, as 2019 n-cov lah, why did the WHO decided to change the name to COVID-19?
Actually, the virus wasn't known as Wuhan coronavirus. It's just because it's come from Wuhan, people name it as Wuhan coronavirus. And the n-cov is basically novel coronavirus, which means that novel means new. So coronavirus basically is the group of viruses there. So it's a new virus that is in the group called coronavirus. So the WHO basically come up with the new nomenclature, basically COVID-19. So in the new nomenclature, basically we're looking at CO is coronavirus, VI is virus, and D is disease, and 19 is the year. Basically, this name has come into existence because they don't want it to be associated with any group of people or any geographical location or any individuals. Basically, we know that there's a virus called Nipah virus. And do you know where's Nipah?
Nipah is somewhere in
Malaysia?
you know that?
Yeah, that is in the country. Okay, Nipah is somewhere in the Great Sembilan.
Yeah.
So when you go to Nipah and then people tell there's Nipah virus, are you afraid to go to Nipah?
There's some ideas, bad ideas
Alright,
about it lah.
because Nipah is not so bad lah. That's why WHO decided not to associate the name of virus with location, a geographical location, a group of people, or any individuals.
But then why we have some virus named as MERS virus, like Middle East or the Japanese encephalitis?
That's why those are the old nomenclature. So that with the new nomenclature, they actually move away from that.
I see.
So that's why the Middle East respiratory syndrome. Okay. Basically, what does that mean? That means that the respiratory syndrome only happened in the Middle East? No. But if you go to the Middle East, you are afraid that you get the symptom because you think that it is in Middle East only. So the WHO actually move away from that, and they name it in a scientific kind of manner so that you won't be associated with a certain location or locality, geographical locality, or with certain group of people or with any individual. So now the virus name is basically the type of organism, the group of organism, the disease, and also the year. So we make it simple, and people won't get confused that this is related to anything, but it's just a virus. We know that viruses are not related to anything. Just like your swine flu, alright. Then you think that okay, because I don't take pig, I'm not in problem, but actually it's not that way, alright. So we need to dissociate with this type of naming nomenclature. That's what the WHO actually decided.
Okay, so just now you talk about swine flu and thought that the virus actually came from swine,
Right.
and previously probably somewhere else.
Right.
So in the case of COVID-19, where does it actually come from?
Okay, so there are some basically evidence that it came from a market in Wuhan. Alright, and the actual source of the virus is basically not known. But we all know that bats actually carry the virus. They're just same like Nipah. Nipah was carried by bats, basically deposited into area where the pig is bred and then the pig continue. So most probably it comes from bat, but exactly where it comes from, basically, is still not really clear. All right, they say that it could come from one of the animals in the sold at the market, but we also not really clear. So the information on the exact source of the virus, we are not clear.
Okay. So now some people say that it comes from bats or animals somewhere in the market.
Right.
So does it spread just that way? But or
It used to basically, the virus when it started, you would have started by spreading from animal to human. Then you know that viruses are a form of organism that actually mutate easily. So with different method of mutation, by mutating, basically you can now spread from human to human transmission. We have known that human to human transmission have occurred in China, and also had occurred in Singapore, and also a few other countries around the world where there's human to human transmission. Even in Malaysia, there's human to human transmission.
what does it mean by human to human? Is it air? Is it by the air that we breathe, or is it just any fluids? Or
Basically, if we talk about this coronavirus, it is basically spread by droplets. Droplets means that it is basically from the fluid that actually the human take, like when you sneeze or when you cough, the fluid comes out in a droplet form. And if you are in contact with the droplet form and the droplet form enter your body, then you'll be able to get it. So does it spread by what we call the air? Not really at the current moment. They say that it might be spread because of aerosolized. That means the droplet become aerosol and it is spread in the air. But that is also not proven yet. So we still don't know. But what we know now is that it is a droplet infection is spread by human to human contact, spread by being near to a person who's basically having symptoms like cough and sneezing. And when they cough and sneeze to you, you might get it. But other than that, not by airborne. Not yet. They have not known that.
So that mask is actually helpful in preventing all these diseases?
Basically, there's two type of masks. All right, the one that people recommend is wearing three-ply mask. Three-ply mask is basically a surgical mask that you wear mask. Right? It does not prevent you from getting the disease, but if you are having symptoms, like if you are having cough, you're having flu, all right, or you feel sick this morning, and then you wear a mask. The reason is that you don't want to spread it to other people. This basically we recommend not just for coronavirus but for any kind of diseases. You need to be able to prevent you don't want you to be the one who spread disease to others. This actually is a very good practice in Japan. Japan people always do that. When they are sick, when they go out, they wear a mask. But if you're not sick, and then you don't have to wear a mask.
I see. Then how about the N95 mask?
N95 mask is only if you, let's say, you are working as a healthcare worker, all right? You're attending to the patient, and then there is a chance that the patient basically would spread to you because you are close to the patient. Then you wear N95 mask, right? And that basically you can wear it, and it actually prevent the organism actually from getting into your body. But that is from breathing, but you still need to wear a face shield, correct? So that the aerosol or the droplet does not go into your eye or any other orifice in your body. So that you need to do also. So you need to wear a face shield, also like N95. But these are only for workers who is basically directly exposed to patient, which means that healthcare workers. But you, as a medical student, you're not going to clinic yet, so you don't have to wear. You're wearing a lab coat.
Yes.
So are you going to clinic?
Yeah, I just came back from clinic.
So basically, if you came back from clinic, you feel that you are exposed to patient, then you might want to wear, but you're just observing, and you don't have to wear N95. And the N95 basically, because we are talking about biological agent, biological hazard. So after you wear, and then after you have attended to the patient, you need to dispose of the mask straight away. You cannot keep it in your room, keep it in your bag, and then bring it to your house and then wear it in your house. You cannot do that. You must dispose of in the hospital. You cannot bring home. That means we don't allow you to bring the hazard home. We don't allow you to bring the bacteria home.
So right now, one advice we can give to our audience is that we only use mask when you are sick. Is that right?
It's not advice. It's basically you need to use mask if you are sick, not just for coronavirus, for any kind of sickness. When you think that you are going to infect other people, like if you are having flu or you're having a cough. That's what we advise for patients who are basically coming in for tuberculosis. Right? Tuberculosis is also a very important disease. Alright, so we ask them to wear a mask before they see a doctor, or wear a mask when you are traveling, so that you won't infect other people. So advice for all diseases, not just coronavirus.
Okay. So what about other precautionary measures about hand washing? Because a few days back I went out to get something from the mall, and I saw that someone actually took the hand sanitizer and actually sanitized the trolley. Is that actually necessary?
Basically, I think that if you want to do that, it's okay. Alright, because we don't know who actually holds the trolley before that. Alright, and how and whether you actually touch your face after you touch the trolley. So it's not about the thing is that about your hygiene practice. So what you practice after you go to the toilet, you wash your hands. Alright, before you eat, you wash your hand. After you touch something dirty, you wash your hands. Alright, so hand washing is basically the most important. Alright, so proper hand washing. And then don't touch your face all the time. Don't touch your nose all the time. Alright, so that is what's important.
So hand washing, what is hand washing exactly? You have to use water, or you can use just the alcohol sanitizer?
Basically, you can use water or alcohol or the sanitizer. You can use both. But water itself is enough. If you have soap, then you can use soap. Right? So adequate running water is enough.
Running water is enough, so you don't need, like after washing hand, then you alcohol rub, no need lah.
No need alcohol rub. But you don't have water, you use alcohol rub, then it's also okay.
Okay.
Because a lot of the time we have no access to water, right? So and we have to touch our face, so we just rub it and then make sure that it doesn't freeze.
Okay. So talking about this COVID, what is actually the symptoms and signs of somebody having this virus?
It's the same as any flu. Alright, flu basically you have fever, you have body ache, you have running nose, you have cough. So it's the same thing. It's a viral fever, viral flu, so you have all these symptoms.
So how would you know that you are having this and not that?
You won't know.
You
won't know whether you're having COVID, having influenza, having SARS, and you won't know until you get tested. Right.
So what is actually causing all this death among the people in China mainly right now?
Basically, most of them have respiratory failure due to pneumonia. Right? So the virus basically attacking the lung, and then it causes damage to the lung, and then the lung cannot recover on time, and then basically that's why they die because of the respiratory failure. And of course, we know that because if you have a large amount of virus go in, your immunity cannot react to the virus quick enough. So basically, we know that we get viral infection all the time, but because our immunity is okay, and we get basically our immunity will react to it, and within certain days, certain number of days, you get better.
So in this case, it will affect some people worse than the others.
It will affect those people who have low immunity.
Low immunity, and
right, like the elderly, the younger population, patient with diabetes, patient with heart disease, patient on immunosuppressant, like people like let's say cancer patients, like patient on transplant patient. So those patients are more affected than others.
So someone who is more has a stronger immunity then will have this common cold symptoms.
Some of us might have coronavirus in our body. I mean, some of people in Wuhan with no symptom, like that will not going to spread to other people. That's normal in any of the viral disease. Alright, basically they infect people, but not all people get sick, and a small number of people get sick. Even that, not all people get very sick, but a small number of people get very sick, and even a smaller number only of the very sick will succumb to the disease. Right? So it's always the same for all kind of diseases. So there's worrying because it is important that we worried about it, and it's important that we control it.
So how severe is it that I need to only go to hospital to have a checkup?
You need to see a doctor when you're sick. Correct. You don't go to hospital. You don't come to hospital. Of course, you go to hospital all the time because you are a medical student.
Yes.
But as a patient, as a general public, you don't go to hospital. You only see a doctor. You can see a GP, general practitioner. When you're sick, your general practitioners think that you need to go to hospital, they will refer you to hospital. You, as an individual, don't go and overwhelm hospital facilities. Don't think that, because I talked to a Chinese guy, I talked to you, you're Chinese, and then I'm worried, I'm now sick, I got to go to hospital. No. You go to see your general practitioner. General practitioner will assess you, and then maybe will refer you.
So when someone is suspected to have coronavirus, this COVID-19, they are suspected because they came back from Wuhan. They have this history of contact. So what is actually the hospital doing right in Sungai Buloh? I think. What is the procedure there?
Not just in Sungai Buloh, even in our hospital here in the Medical Center, we accept patient with this problem, and we do the same investigation that Sungai Buloh is doing, Hospital Kuala Lumpur is doing, and also there's a list of hospitals from each of the states. Actually, they accept patient who is basically suspected of coronavirus.
So how do they actually test it? How do we test it?
So the virus is secreted in the secretion. It's there in the secretion. So they will do a throat swab. They'll take a cotton bud, all right, a long cotton bud, not a cotton bud. They use a long one, a cotton bud with a long stick, and they'll just basically take some liquid from your throat, take some liquid from your nose, put it in a test tube, and send the test tube for testing. So they use some kind of testing, PCR testing, and then they basically to see whether the virus is there. So if the virus is there, then basically they will tell you the virus is there. So they do it when you come in, they do it for after 72 hours. But only to those that are suspected of exposure. So not to everybody, because the test is expensive, there's no reason for you to test if you don't have history of exposure.
So currently we are actually in the midst of getting the students are actually getting in back to the university.
Yes.
So and we have some students that are coming from China. So what are we actually doing in order to prevent? You might not know that they are coming. Where are they coming from?
So the university under the basically have directed that. All right, for the first week, we will try to avoid contact, the big group contact. That's why they have basically advised that big group contact, like classes, can be conducted in using what we call online, or using what we have in Spectrum. Of course, but for small group teaching, like here you're sitting with me now, all right, then there shouldn't be a problem. Like he's going to clinic all the time, there shouldn't be a problem, right? Of course, people are coming back from affected area, like from China, like from Wuhan. Basically, the dean actually have come up with an advisory that you have to be isolated for 14 days. So the dean have actually, the VC actually have a procedure to how to isolate you for the next 14 days.
So there's nothing to worry for other people that are actually coming back to UM who are not, who are actually not coming from there.
I mean, if you're worried, then you worried. It's more worrying by going out, alright, shopping, everything, alright, or more by when your brother or your sister going to school. School is still going on, correct? Yeah, so are they worried?
Not that I know of.
Same thing. Are you? I mean, if you are no exposure, if your group is not, so the BC actually have done a good job. Basically, they say that okay, those people from China, we will quarantine. We will not quarantine. We will isolate you. You will stay away for 14 days. Then, if there's no symptoms, you can come back to class. And they won't penalize those people in the sense that they won't penalize them that are not attending class, no things like that.
So only from China that we need to isolate. How about from other countries that are affected?
Basically, if you think that from any countries, not really, because the transmission is still very low. Alright, the number of people is still very low. You know, from China, it's only basically if you're from China, yes, but only from the main thing is only from three provinces. Alright, one of them of course is Wuhan province, Hubei province in Wuhan. Alright, so Wuhan is a big city, you know that. Right. So other than that, you don't have to basically isolate them for this purpose. There's not basically there are some bases, but you don't really need to isolate.
So speaking about people, those in Wuhan, in the Hubei province, what does the current statistic actually show? Is it actually any different from say SARS, MERS?
Of course, we know that the number of people, the number of mortalities is more than 1,000. The number of people affected actually has went on few, I think 40,000, something like that. I'm not sure the exact figure now. So it is more than SARS currently. But the two things we must keep in mind, all right, is that when you're talking about an infection, all right, you get sick, all right. As I mentioned earlier, you get infected, you don't get sick, all right, or you get sick, but it's very mild. You don't go to the clinic, you go to the hospital, or you get a little bit sicker, or you get very sick, but you don't. So now basically there's more monitoring, there's more testing. So when you test more, you are bound to find more patients. Right? You're bound to find more patients, and then that's where basically the numbers will increase. All right. So, but there is a problem. But I think the China government basically is doing what best they can do. All right. Of course, we know that this issue is basically new. All right. For any country, will be doing the best they can do. So the number is going. I think it's decreasing already. Overall, the number of infected daily is decreasing. Right. But of course, we take some time before actually it plateaus and then goes down, and then it might still be there because it's a virus. It might not go away, or it might just go away. Because we know the mortality is not so high. Mortality is around 2%, right, compared to SARS 10%. Compared to Nipah virus is around 50%. So when the mortality is not too high, of course the spread is more. The mortality is high, everybody infected died already, so it won't spread. So mortality is not so high, so the spread is more, so more people get infected, but more people get found infection. So that shouldn't be.
So we are expecting the progression to plateau sometime soon.
Basically, we are expecting the progression to come down, and then it will plateau at just a smaller number. It might be there because it's just a virus. Because everybody, when you get infected, they will become immune. When you're immune, you won't get infection anymore.
Question?
Is there any reason why the WHO yesterday just announced that Malaysia have to be aware of another outbreak?
It's basically WHO is to make sure that we are prepared. All right. So actually, Ministry of Health in Malaysia actually are prepared already. We have all the things in place. All right. So when the WHO warned us that we got to be prepared, I think that's a good thing for us to do. Basically, they will allow us to put resources into it. All right. We know that resources are shared in this country. All right. The budget is shared. It means shared with other ministry. So our budget is this. If the WHO says it's important, then more money will go into this, and we'll have more preventive measures to make sure that everything is running.
So Quite recently, WHO actually announced that it's a public health emergency of international concern. What
Yes.
does that actually mean?
That means that it means that WHO will be able, or countries and WHO have the money will be available for smaller countries or less developed country to use to control the measure. So WHO get money from United Nations. United Nations get money from individual countries. So the money is just like as I said mentioned, our budget, so it's shared. So when you say it's emergency, so a lot more money will go into this, and then if that country need it, basically you will be able to use it.
At the level of WHO lah.
At the level of WHO to give to smaller countries, less developed country, less rich country. Correct. And also WHO can basically send people to your country, so the budget is there for the country.
Okay.